So if blue was the Delta variant, which just hit us really hard in July and August and September and October, everything was Delta way back then. And then that one started to go away when we started to get the Omicron. Here are some of the different subvariants of Omicron. So we've got the BA1, two subvariants that came, and in December and January and February, lots of people got sick. And what we're seeing now is this BA2 subvariant of Omicron that is just kind of stealthily starting to come up. And so even as these other variant is going away and our other infections are going away, this green line is something to watch. So what we have to kind of consider is, how immune are we actually? Some people are unvaccinated. Some people have had a vaccine series, but no booster. Some people have been vaccinated and boosted. Some people have had the disease once, but maybe it was a year ago, or they've had Omicron recently, but nothing else. So it's super complicated as to how immune people actually are. And what I would say is that the chance that you will be exposed to the virus that causes COVID-19 is not going to go away. The variants that we're exposed to now are even more infectious than Omicron, which was many times more infectious than the earlier varieties. When you're immunocompromised, I would suggest absolutely to have your primary vaccine series and that booster, even if you've been sick in the past and had the actual disease. And that I would expect that almost all of us will at some point here be exposed to this new variant. We know that the vaccine series and then the booster dose, and 2 weeks after that, about 70% of people are completely immune to Omicron, including probably this new variant. And about 30% of people might get a breakthrough infection, but we expect it to be mild. So I would say things are not going away. I think it's a little bit premature to be taking off your mask if you're immunocompromised, and that would include pregnant people. If you've been vaccinated, boosted, you've had Omicron, you're not immunocompromised, then I think, living a normal life and following the public health recommendations for mask mandates seems totally fine for me. But people that are immunocompromised might want to consider this and be a little bit more careful and wait to hear what we get in the news cycle in the next month. It's been dominated by the invasion of Ukraine, and everything about Omicron has kind of gone away. But in the next month, I'd be very curious to see what we're dealing with this new variant.